The pancreas is an elongated gland with a nodular consistency located in the upper part of the abdomen and in particular immediately behind the stomach and near the duodenum. As an endocrine gland, the pancreas is mainly responsible for secreting a series of hormones that regulate blood glucose levels, including insulin and glucagon. As an exocrine gland, however, it has the task of producing pancreatic juice, a colorless liquid rich in enzymes essential for the digestion of proteins, fats, and complex sugars. However, when the pancreas begins to no longer function properly, it can send us a series of signals that indicate a problem related to its digestive or metabolic functions. But what are they? Let's go and see them. Abdominal pain. One of the most common symptoms of a pancreas problem is the onset of pain localized in the upper abdomen, which in some cases can also radiate towards the back. It can be dull or intense and can worsen after drinking or eating, especially if you consume foods with a high fat content, as they require a longer digestive process than carbohydrates and proteins. For this reason, if the pancreas is inflamed or damaged, the production of these digestive enzymes can be difficult and increase the pressure inside the gland itself, causing pain. Among the main causes we find pancreatitis, an inflammation of the pancreatic gland that can be acute or chronic. In the first case, it manifests itself with the sudden onset of intense abdominal pain, while in the second case, the pain is generally dull and constant over time. The inflammatory state affecting the pancreas leads to an irreversible deterioration of its structure and functionality. Another possible cause of abdominal pain is pancreatic calculosis, a pathology characterized by the formation of stones inside the pancreatic ducts. These are usually fragments of calcium carbonate that have solidified following the stasis of pancreatic secretions, but also as a consequence of alcohol and drug abuse, as well as infections, smoking, metabolic disorders, and alterations of the immune system. Fatty stools. Another symptom that may indicate a possible malfunction of the pancreas is steatorrhea, a medical term used to indicate the presence of an excessive amount of fat in the fecal material. These are undigested substances that for some reason have not been adequately absorbed by the intestine, ending up accumulating in the feces. The latter will then take on a shiny, oily appearance and often have a strong and pungent odor. One of the most common causes of malabsorption steatorrhea is exocrine pancreatic insufficiency, a condition characterized by insufficient production of pancreatic enzymes by the exocrine portion of the gland. Some of these enzymes are amylase, lipase, and protease. Food will not be adequately broken down into its simplest components, preventing the small intestine from properly absorbing essential nutrients. The most obvious clinical symptoms are steatorrhea, gastrointestinal disorders, abdominal swelling, and involuntary weight loss. This is because the malabsorption of nutrients reduces caloric intake, preventing the body from obtaining the necessary energy from the food ingested. A progressive weight loss will be observed, accompanied by a reduction in muscle mass and signs of malnutrition, also due to the lack of vitamins and mineral salts. Jaundice. Jaundice is a yellowish coloration of the skin, mucous membranes, and sclera, the white part of the eyes. It occurs as a result of increased levels of bilirubin in the blood, a yellow-orange pigment which is produced primarily by the breakdown of hemoglobin following the destruction of red blood cells that are aged or damaged. Under normal conditions, bilirubin flows into the intestine, more precisely into the duodenum, through the bile ducts. However, in the case of a problem with the pancreas, such as the presence of a tumor mass or chronic pancreatitis, the normal flow of bile can be obstructed. Unable to reach the intestine, it will begin to accumulate in the blood and then deposit in the tissues, causing the appearance of jaundice. You will notice a yellowing of the skin and mucous membrane, accompanied by dark urine and light-colored stools. Most blockages are caused by a gallstone, but in some cases they can be traced to a tumor of the bile ducts or pancreas, especially in the head of the organ. This is the largest part of the gland, located near the duodenum, and is particularly important for the production of digestive enzymes and hormones that regulate blood glucose levels. Involuntary weight loss. Unintentional weight loss that is not explained by a change in diet or exercise can be a sign that something in the body is not working properly. Possible causes include a dysfunction of the pancreas that can interfere with digestion and absorption of nutrients, leading to unwanted weight loss. In chronic pancreatitis, for example, the body secretes too few pancreatic enzymes, including amylases, lipases, and proteases. The body is then unable to fully absorb nutrients from the food it eats, and therefore not get all the energy it needs to function. This state of malabsorption can cause weakness, tiredness, and vitamin deficiencies, as well as compromising bone and muscle health. You will notice significant and progressive weight loss accompanied by excessive fat in your fecal material. Another possible cause of involuntary weight loss is pancreatic cancer. This is one of the most common symptoms of this malignant neoplasm, and according to some estimates, about 70% of patients with pancreatic cancer develop significant weight loss. This is because the growth of the tumor mass interferes with the production of pancreatic enzymes and alters metabolic processes. Some studies have shown that pancreatic cancer can promote the onset of diabetes or the worsening of pre-existing diabetes, as it appears to make the body's cells resistant to insulin, a protein hormone essential for regulating blood sugar levels. Experts therefore remind to pay particular attention to a sudden onset of diabetes and its rapid worsening. In conclusion, we have seen how the pancreas is an organ of extraordinary importance for digestion and metabolism. However, when it is compromised by certain diseases, its functions can be altered, leading to a series of different signs and symptoms. It is therefore important to promptly contact a doctor or specialist in order to receive an early diagnosis and adequate treatment, thus improving the symptoms and quality of life. To take care of the pancreas, you need to start by adopting a healthy lifestyle, following a balanced diet, rich in fruit and vegetables, avoiding excessive alcohol consumption and smoking, and practicing regular physical activity.